just because patients have one or more of the symptoms on the TMD symptom list, frequent or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, fullness in the ears, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Just because they have one or more of those symptoms does not mean they necessarily have TMD. So you have to be able to keep in mind the potential differential diagnosis of these symptoms. Our problem of the doctors treating TMD is our medical colleagues don't think of TMD in their differential diagnosis when they have patients with frequent or recurring headache, earache, jaw pain, neck pain, ringing in the ears, fullness in the ears, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness. If they can't open their mouth, admittedly, they may think this is a jaw joint problem. They might think that. But the other symptoms, going to a PCP, a medical doctor, his first thought is not going to be TMD. One of the other things that I mentioned in previous episodes was my experience talking with a room full of 30 family practitioner MDs. This was a couple years ago. And ask the room their opinion, what they thought they would do if they were presented with a patient with acute and frequent and recurring severe headaches. And I said, what is the first thing that you would do, without giving them a list of options? I just said, what is the first thing that you would do? And basically 90% of the room agreed that the first thing they would do is they would send the patient out looking to get a MRI looking for brain tumors. Now, these are family practitioners, but the first thing they wanted to do was check out the head for brain tumors. And brain tumors are certainly present, but the incidence of brain tumors in comparison to TMD are extremely limited. And sending a patient out for an MRI, you just wasted, $2,000 or $3,000. Where you can examine a patient for TMD, if they have frequent or recurring headaches, all you have to do is put your fingers in the glenoid fossa, have them open widely, push hard, and have them bite rapidly. And if it hurts, the joint's inflamed, you've made your diagnosis.